So today we're going to talk all things TMJ. My name is Dr. Ron Miller. This is Dr. Thomas Eberly. We're some of the specialists here at Pursuit, and we're going to talk about TMJ. So this is that case where you're having pain here, and you may have a headache, you may have neck pain, all things TMJ. So if someone's suffering with TMJ, what's some important stuff to know about regarding what is TMJ and what's the best way to treat it?
Yeah, well, in short, TMJ stands for temporomandibular joint, which is the joint where your jaw inserts into your skull. So that can be quite painful because when you're talking or just trying to eat food, like even something as simple as an apple or chewing steak, all of that's going to hurt more. Typically, when you have TMJ, you have night pain. Many patients have some anxiety, so they are grinding their teeth at night. That's all part of it. And then many patients with TMJ also have upper neck pain because the jaw ties in with the upper neck. So headaches can affect your vision in some cases. So all of these things we are going to evaluate and see what is causing the TMJ and then having the appropriate treatment.
It's kind of like an unhappy triad. We see a lot of that together. TMJ pain, headaches, and neck pain all together. So it's very common to have that. So
yeah.
What are some of your favorite treatment techniques that have worked for you in the clinic?
Absolutely. The TMJ is a very delicate joint, so you have to approach it very carefully. Many times I've seen other therapists be a little too aggressive with it. It's actually very difficult to find a physical therapist or any practitioner that treats this area. I've completed a residency and fellowship in orthopedics, and we focused on the TMJ as part of the instruction. So I teach TMJ treatments at the university level as well as to postgraduate physical therapists because we need more practitioners that treat this. In short, you need to identify, again, the problems. And I know I'm being general because there are many specific things going on that could be going on with the TMJ. But usually when you have pain in any area, you have a lot of muscular guarding and tightness. So this whole area will be tender. So the initial strategy is just get the tenderness of the muscles down, improve the mobility of the joint, and that will get you sleeping and eating food better. And then from there, we can go into the neck because there is always a neck component to this and getting the neck moving and feeling better. And then from there, moving on into strengthening any muscles that need to be strengthened. Many times there's weakness after years of atrophy. Also, it's very important to understand that with many TMJ cases, you need a multidisciplinary approach. So we do things like recommending the right mouth guard or different things you can put between your teeth when you're for exercise or even for sleeping. Additionally, we have contacts in the community. If you're having other issues like anxiety or depression, that could be some of the underlying causes of TMJ. We have contacts with those people. And then finally, and rarely do I see this, but sometimes you need to see a dentist because sometimes your teeth have worn down, especially if there's a chronic problem. I find a mistake many people make is when they have jaw tightness on one side, they get their teeth ground down early. And because their jaw is a little off. But the problem is the jaw is not off because of the teeth. Sometimes the jaw is off because the muscles are spasming. So if you can get the muscles to relax and everything resets, now you don't need to see a dentist. So I usually like to pull in a dentist kind of after we can get those muscles reset and then take a look. And if you feel like your jaw's off a little still, then have a dentist evaluate that. So
many times it does take multiple disciplines, and we team treat with other clinicians and dentists and stuff like that. An important thing to notice is Thomas said there's a joint problem and a lot of times a muscle problem. So both can be causing pain and some of the problems that you're experiencing. So the key is you can't just rely on Botox or like a muscle relaxer. That's treating only half of the problem. The other half could be the joint isn't working and you're not able to open up properly yet. Or you can't just treat the joint and then forget about the muscles, the masseter, temporalis, medial and lateral pterygoids. There's a lot of muscles around there that need to be addressed. So the important thing is to treat the joint and the muscle to get good results that way. In worst case scenarios, yes, we may have to bring in the dentist and look at like mouth guards and bite plates and stuff like that. Anything else that you want to add in regarding TMJ?
I would just say the last thing is posture. How you are sitting will affect, believe it or not, where your jaw sits. So teaching the good posture will help align your jaw in a proper way and take some stress off of it. So
if you're struggling with TMJ, hang in there. There's always hope. we believe that there's always a root cause to someone's pain. You just have to find someone that is able to solve that. So if you're struggling with TMJ or you have headaches or any kind of myofascial pain along the jaw, we would love the opportunity to help out. You can visit our website today at pursuittherapy.com or give us a call today at 407-494-8835. Thank you.
Thank you.